Laser treatment is the less invasive type of treatment for glaucoma. It helps control the pressure in our patients with primary open-angle glaucoma, narrow-angle glaucoma, and various complex glaucoma as well, by preventing or reducing the need for invasive glaucoma surgery like trabeculectomy or tube operations. And in many cases, it can help either reduce the load of number of drops that the patient use, or by totally preventing the need for drops in cases of mild glaucoma and ocular hypertension, this can be achieved with selective laser trabeculoplasty, which is a particular type of laser which is very commonly used. The commonest that is used these days is selective laser trabeculoplasty. However, the techniques differ from from case to case. The three commonest ones used are selective laser trabeculoplasty, YAG laser iridotomy, and cyclodiode. Selective laser trabeculoplasty is approved by NICE and recommended to be the initial treatment for newly diagnosed patients with primary open-angle glaucoma and ocular hypertension, even before they need to start the drops. This can help remove the need for using drops in significant number of patients who find difficult using the drops because of dexterity issues or side effects from drops, or just because they find it difficult to instill the drops as well. However, in appropriate cases, drops will be prescribed and required. Selective laser trabeculoplasty is a minimally invasive procedure and has a low rate of side effects. The second procedure that I mentioned is YAG laser iridotomy, which is used in cases of narrow angle glaucoma, which is a second type of category of glaucoma where the drainage channels, not only they are not working, but the access to drainage channels is restricted because of narrowing of the angle of the eye. In such cases, laser light is focused on a part of the iris to allow a channel to form between the front part of the eye and the back part of the eye, so we can remove the block in the pupil, which leads to suddenly raised pressure or chronically raised pressure. The third type is the cyclodiode laser, which is usually used either in cases where other standard form of laser or surgical intervention is not working or has failed, or in some cases for patients who can't have bigger surgery because of their general health condition or ability to cope with follow-ups. It is done in theater rather than outpatients. It's a very short procedure as well and can help reduce the pressure, but it's usually considered after other less invasive procedures are tried. All three types of laser that I have mentioned work differently, but they all are done in a painless manner. Different type of lasers require different drops to medication to control the pain, to prevent any pain during surgery. Selective laser trabeculoplasty is done in an outpatient, as outpatient procedure with just numbing drops, and no further anesthetic is required, and patients are quite comfortable during the procedure. Similarly, YAG's laser iridotomy is done in an outpatient setting with just numbing drops on the eye, and patients are quite comfortable. They might feel a little bit in this type of laser, but most of them don't call it pain. They might have a slight discomfort for a few seconds, which settles down very quickly. Cyclodiode laser, which is the less common of these forms and used for complex or end-stage glaucoma, or where other surgery cannot be done or has failed, is done under a proper local anesthetic. So the patient's experience is pain-free, but they're given an injection before the procedure around the eye. The injection doesn't go in the eye, but their eye is completely numbed with the anesthetic infiltration around the eye. So they do feel for a few seconds when that is being done, but after that, they're completely comfortable. Laser surgery is used most of the times as a something that will cause less side effects or will prevent a bigger surgery, which will have higher chance of side effects. If we talk of selective laser trabecoplasty, in a small number of patients, it can cause a little bit of inflammation in the eye, which is usually short lasting. In a small number of patients, again, the pressure can initially rise, but this is monitored closely, and if required, adequate treatment is given. But it is uncommon for it to cause a permanent rise in pressure, and it succeeds in about 70% of the patients to adequately bring down the pressure. Like any procedure, there could be a small reduction in vision or a requirement for further surgery, but this is quite uncommon in selective laser trabecoplasty. YAG laser iridotomy, as it produces a channel between the back part and the front part of the eye, can allow more light to go into the retina, and occasionally, in some patients, can cause a visual phenomenon like white lines or reflections. But we try to, in most cases, achieve the result without any of these by placing creating the channel in an area which is nicely covered by the upper lid. Also, there could be inflammation, raised pressure, and swelling at the back of the eye in some cases, but adequate medication is given after the laser to minimize the incidence of either of these side effects. Cyclodiode laser is a slightly bigger laser in a way, and more for the patient, and does have a side effect profile. And we treat, as we do the laser, we give patients medication to control the inflammation, as there can be inflammation after the laser. Occasionally, if the laser is overdone, the pressure can get too low. Therefore, we do it in a staggered manner rather than trying to do everything in one go. So because low pressure is slightly more difficult to deal with than moderately high pressure. Cyclodiode has a few things which can happen uncommonly as well. So we counsel our patients individually, because the risk is quite individual, and we counsel all of them individually as to if they are likely to be at higher risk of side effects. Okay, again, for three different types of lasers, the indication is different and procedure is slightly different, and the recovery is also slightly different. Selective laser trabecoplasty, the patient can start their activities the same day, straight after the laser, because in none of the lasers any incision is made in the eye, so the eye is completely sealed. Patient's vision is not significantly affected for more than a few hours, and that is also because of the drops that are given at the time of the laser. We expect the patient to be doing all their normal activities, including driving, from the next day. We do suggest that they don't drive back after the laser, because the drops that we put to get ideal result with the laser can sometimes blur the vision for a few hours. YAG laser iridotomy is slightly different because it's done for acute angle closure glaucoma. In those cases, the recovery could be slightly longer, but in routine cases of narrow angle, again, patient is expected to start their normal activities from the next day, fully, including driving, and on the same day for most of their activities as well. Cyclodiode laser, slightly longer period. We put a pad on the eye for about 4 hours, but after the patient goes home and once the anesthesia finishes, the patient is able to do most of their activities that they used to do before the laser treatment, and from next day they're usually able to drive as well, unless they're finding it uncomfortable or having any problems, in which case we are more than welcome to see them and try to help.